When patient comes to the physiotherapy OPD with complaints of low back pain, often referring down into the lower limb beyond the knee joint, and when the SLR testing or the slump testing aggravates or attenuates the patient's symptoms, then lumbar mobilization with sciatic nerve glide is one of the techniques that can be incorporated into the treatment protocol. To perform the treatment, the patient is made to assume the side lying position so that the affected side is up. And now from here, the lower limb, that is the unaffected side lower limb, is made to assume a hip knee flex position so that the patient remains relatively stable. The hip of the affected side is made to flex around 90 degrees and the knee is flexed to 90 degrees. It is supported by a pillow so that the hip joint is neither adducted nor abducted. Now the therapist is going to determine the level which he or she needs to treat. Let's say, for example, if we are treating a patient with a L4, L5 dysfunction, in that case, what the therapist is going to do is, therapist is going to come closer to the patient and is going to place the thumb of the dominant hand over the L4 spinous process. So that means if we are treating the L4, L5 level, then the thumb is going to come lateral to the L4 spinous process, and this is going to be reinforced by the thumb of the other side. And now a strong transverse glide is going to be applied to the L4 spinous process, and while maintaining this glide, we are going to ask the patient to extend the affected side knee joint, and this is going to release the tension in the sciatic nerve. And come back. And 3 such repetitions can be performed in a single sitting, and then we can again go back and check the SLR symptoms. So what this maneuver does is it rotates the L4 vertebra towards the involved side, and as a result there is a relative rotation of the L5 vertebra towards the uninvolved side, which opens up the facet joint and helps in releasing compression and tension within the nerve root, thereby relieving the pain symptoms. So this was about the lumbar mobilization with sciatic nerve glide technique. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.